Morning. I'm Rob Lumbach, and I will be moderating this morning's panel discussion titled Contact Tracing and COVID-19 Health Disparities in New Jersey. I'm the Director of Community Engagement for our NIEHS-funded Center for Environmental Exposure and Disease, or CEED. Sorry about that. And with me is Carrie Butch, Community Engagement Coordinator, who will be working the chat box for audience questions and discussion. This is the sixth and final session of our third annual Environmental Health Summit, in which we have covered current environmental and occupational health issues that are of importance to the people of New Jersey. The theme of this year's summit has been COVID-19, environmental and occupational health, and justice. Please note that this session is being recorded and will be posted on our website. With news of rising numbers of COVID-19 cases and hospitalizations in New Jersey and across the country, it is clear that we need effective contact tracing now more than ever to fight what is shaping up to be a dreaded surge and to avoid the severe mitigation efforts and stay-at-home orders that we've had in the past. Contact tracing is vital to shutting down the epidemic and can save lives. Is contact tracing in New Jersey up to the challenge? At the same time, I think we are all aware of the great inequity and how COVID-19 has affected different populations in the state. Age-adjusted case, hospitalization, and mortality rates in African American and Latinx populations are 2 to 3 times the rates of whites in New Jersey and across the US. As part of a system that includes testing, case investigation, and social support, contact tracing has the potential to reduce COVID-19 health disparities. However, we've heard much about challenges related to knowledge, trust, continued systemic inequity, and politicization that threaten to undermine and even reverse efforts towards greater equity. This morning, we're excited to welcome a group of panelists who have a broad range of roles in fighting the pandemic. We will hear from the front lines about how contact tracing is being done in New Jersey, including the challenges and day-to-day realities of a difficult but rewarding job. We will focus on the challenges involved in inequitable contact tracing and the potential role of contact tracing to reduce health disparities. For our audience, please use the chat box to enter questions, which I will direct to the panelists following the discussion. So now I'd like to introduce the panelists. So first, Dave Henry is the health officer for the Monmouth County Regional Health Commission. He is responsible for the public health activities of 18 municipalities. He has 36 years of local public health experience. He has served as the president of the New Jersey Health Officer Association and in numerous other leadership positions advocating for public health at both the state and local levels. Welcome, Dave. Rupal Nai graduated from the Rutgers School of Public Health with an MPH degree and with a concentration in epidemiology just this past May. After graduating, she joined the Camden County Health Department as one of the initial cohort of contact tracers. She currently qualifies as one of our seasoned contact tracers for the COVID-19 pandemic. Rosabelle, greetings and welcome, Rupal. Rosabelle Pastrana Vasquez is a physician and a community health ambassador with the New Brunswick Healthy Housing Collaborative, a project sponsored by the Robert Wood Johnson and St. Peter's Hospitals, New Brunswick Tomorrow, and the Middlesex County Office of Health Services. Rosabelle joined the Middlesex County Medical Reserve Corps as a volunteer to help county residents, test county residents and perform contact tracing for COVID-19 at the New Brunswick testing site, serving as a bridge to reach the most vulnerable population and community members. Welcome, Rosabelle. Mariam Merced has been the director of community health promotion, the Community Health Promotion Program at Robert Wood Johnson University Hospital and Barnabas Health for nearly 3 decades. In this role, she works closely with community organizations and residents to develop innovative and accessible preventive health services and educational programs in Middlesex County. In addition to serving as a panelist in this morning's session, Mariam will translate for Rosabelle. And then our final panelist, who hasn't joined us yet, is Harry Halkidis. I guess I'll introduce him now, and hopefully he will be joining in a moment. So Dr. Halkidis is professor and dean of the Rutgers School of Public Health. His life's work has examined and intervened in the complex systems that influence infectious disease and lead to health disparities, with a focus on sexually transmitted infections and the LGBTQ+ community. Most recently, he has been a leader in New Jersey's contact tracing efforts, helping to develop the curriculum and launch the New Jersey Community Contact Tracing Corps. Dr. Halkidis, thank you for joining us. Welcome.
Sorry for the drama. I was having some like WebEx drama, but apparently I figured it out because you know, whatever. Thank you.
Excellent. Thank you for joining us. All right, and now I'm going to start us off with some questions, a round of questions for the panel. Each panelist, I'd like you to give us a nice substantial answer in about 3 to 4 minutes or so. So actually, to start with you, Terry, I'd like to ask you, what is contact tracing? And if you can give us the big picture on how contact tracing is done and why it's so important in our efforts to curtail and fight the pandemic.
Well, and Rob, thank you. And thanks everyone for joining us this morning. And I apologize for my technical difficulties, but I'm almost 58 years old. I can barely use my cell phone. So contact tracing. Contact tracing is a procedure that is a system and a behavioral approach that has been used in public health for about 100 years. It is an opportunity for us to identify individuals who may have been infected by an infected individual. So, for example, when we have a measles outbreak, or we have the 1918 flu outbreak, or we have an HIV outbreak, contact tracing is a procedure by which local public health officials do an investigation of the person who is infected, and then begins to try to identify individuals who that person may have infected as a result of some transmission vector. So, for example, in the 1990s, it's also known as partner notification. In the 1990s, when I was beginning to do a lot of my HIV work, informing partners of their potential exposure to HIV was one way that we thought we could control the disease and manage the disease effectively. Okay, so in the last year, we have tried diligently. So it's basically a human behavioral interaction. It's an interview. And the benefit of using contact tracing is that it, one, lets a person who knows that they are at risk, and then that allows that person to take the procedures and the cautions necessary to protect others whom they may infect. And in this current moment that we're in right now in our history, contact tracing is perhaps more important than anything else, because we have no vaccine, we have no truly effective treatment, and the fact of the matter is that there are infected people, up to 50%, who are walking around who do not know that they're infected, right? So when a person is identified as infected who has no symptoms, then contact tracing is a critically important aspect to be able to contain the disease. So let me give you a story, an example. So I had a very mild version of COVID-19 in March. I'm very happy to report 7 months out, I still have antibodies, which is phenomenal to me. So I'm going to ride that all the way into 2021. And we knew about COVID-19, but I felt a little sick. And had I not known about COVID-19, I would have gone about my life, like everyday life. I would have gone to the gym. I would have gone everything. Most people don't even get those symptoms. I had just like a little headache and a little stuffiness. So it is very possible for an infectious person to be walking around infecting other people. The minute we identify a person, infectious or not infectious, Contact tracing provides us a way to give a warning signal to everybody else in that person's social circle that the infection is present, and that they have the possibility of having been infected, and that it is then that person's responsibility to either get a test on their own or to quarantine or do any of the things to continue to protect our community. It is, my last sentence, it is an altruistic, social, really responsible behavior that we're asking everybody to engage in. Okay, thanks.
Great, thank you. All right, so next for Dave. So we've all heard that frontline, local health departments play a really essential role in the front lines of contact tracing. And Dave, you run a large health department with covering 18 municipalities. Would you describe for us how contact tracing actually works in your local health department?
Yes, thank you, Rob, and good morning, everyone. I'm honored to be here today. Basically, it's been kind of challenging to do contact tracing in this era of COVID. Basically, what happens is we get a laboratory result of a positive COVID case. And then what happens is our contact tracers or case investigators, they call the index case and try to get who their close contacts were. And we would add those contacts into the list, and then we would call those contacts. It can be anywhere from a close household contacts, family of 5, all the way up to the school system. I mean, just this morning, I think we have 110 contacts that my staff is entering into the system as well. So all these people have to be entered into the system, into the ComCare system, and they have to be followed at 7 days and at 14 days to see if they develop symptoms or test positive, so they would, so we could proceed from that standpoint. So it's a 7-day-a-week job. We've been using the Rector's contact tracers. I think we have at least a dozen of them currently, and we're trying to onboard even that much more to prepare for the next surge. But it's a very intense process. And as the Dean mentioned, this is a time-honored public health process, but we need the cooperation of everybody. And whether it's because of fatigue, because of fear, we've been having challenges from the standpoint of people cooperating with us, whether it's parents, whether it's college students, or others. And so it's been our main goal is to prevent the spread of illness and to mitigate as quickly as possible. And we do face some challenges from that regard in regards to some of the laboratory tests have been delayed. They might be rapid tests, but they're still delayed maybe up to 5 to 7 days. And that makes our job even that much more difficult, where my staff has to directly contact the index case to see if we can get a copy of the laboratory report, because it's key to have that data in our hands, for us to start the investigation. And with that, I don't want to run too close over my 3 minutes. So that's some of the benefits and the challenges that we have running a large health department and trying to coordinate and contact people to mitigate this pandemic.
Well, thanks very much, Dave. I think we'll be returning and discussing some of those challenges as we progress in the session. So the next question I wanted to ask is for Rupal. So Rupal, you've been on the front lines of contact tracing with the Camden County Health Department since May. What are some of the conversations like when people answer your calls?
Right. So we have a very specific process with contact tracing. So first and foremost, we want to make sure we're talking to the patient. So what we do is we call and confirm some information with them to confirm that we are speaking with the patient. After that, we kind of go through and ask them, if they're aware of their results, because sometimes we're the first ones to give them their results. So it's really important for us to make sure that they are aware of their results. after that, we kind of consult them and let them know that, you know, answer their questions, any questions they might have, if we are the first ones to tell them that they are positive. Oftentimes there is panic and stress and anxiety that comes with that positive result, so we try to consult them as much as we can. So after that, we kind of interview them and ask them questions about their symptoms. Symptom onset is very, very important with contact tracing, because with symptom onset, we go back 2 days from their symptom onset. That's when their infectious period begins, and that's when we really do the contact tracing. So after that, we kind of ask them more specific questions, for example, where they're living, who they're living with, what kind of situation they're living in, especially if they're in an apartment or if they are in a household of 10 people. These are really important things that we wanted to take note of. And after that, we ask if they are working, any workplace information, or any other activities that they have done. And all of these things are where we get a list of those contacts that they may have exposed them to COVID. So after this, we, as Dr. Halkidis said, we do register all of those contacts, and Mr. Henry said as well. So we register those contacts and we reach out. So a lot of the conversations with cases can be very frustrating because they are trying to deal with, you know, having a positive result. Contacts, we have been having issues with cases giving us contacts. They're very hesitant to give us that information. And with contacts, it's difficult to sometimes reach out to them and really get them quarantined sometimes. So those are what conversations have been like. It's really a mix of people really compliant and people that just don't want to listen to us.
Thank you. I think, again, we'll have some more discussion about some of those difficulties and challenges in our discussions section. All right, so next I wanted to ask Rosabelle, who's been working in the New Brunswick community, you know, with the Latinx community, what particular challenges she has been facing promoting testing and contact tracing, you know, in that community, and what she may have been trying to do in order to overcome those challenges. And, Mariam is going to be translating. Thank you.
Okay. Bueno, afortunadamente el trabajo que realizamos como promotores de salud junto al departamento de Mariam nos ha ayudado, me ha ayudado a conocer a mucha gente de la comunidad. También participo en una iglesia y conozco a muchas personas de la comunidad. Entonces, el conocerme y en la confianza de las personas creo que ha sido algo de mucha ayuda para que las personas, al verme dentro del sitio de pruebas y al hablarles español en su mismo idioma, tengan confianza en mí para poder decirme o llamarme por teléfono o mandarme un mensaje, dónde puedo irme a hacer la prueba, tengo estos síntomas, usted cree que yo tenga el COVID, y entonces yo lo primero que les digo, pues usted tiene que usar mascarilla, trate de estar en un cuarto si es posible, no tenga contacto con las otras personas, haga hoy mismo una cita para hacerse la prueba, yo la veo en el sitio de pruebas.
So Isabel is explaining to us that through the work that she has done here with the Healthy Housing Initiative, which she worked with as a community health worker, has allowed her to meet and visit and do home visit to many residents in the city. She's also very active in her church, and she directs a dance troupe of children there, so she knows a lot of the families. This has allowed her to meet many families in the city. Through her work here, she has been able to build trust with those families, right? Which is the key thing that she's trying to explain us. When she does this work, people get to know her, get to know the work that is being done at the hospital, at the church, and that's allowed people to get to know her. She lives in this community. The kids go to school in the same neighborhood. So when people call her and ask her, you know, I'm having this symptom, she explained to them, you need to wear your mask and you need to make sure that you go for testing.
Entonces es muy gratificante para mí el hecho de cuando ya los veo haciéndose la prueba. Y soy de las pocas personas que hablan español que está en el sitio, entonces usualmente me toca hacer pruebas también a ellos.
So it's been gratifying for her that she is also at the testing side. Like you had mentioned before, she became part of that medical corps of volunteers for the county. So as she asks people to come and get tested, she's also there at the testing site. And she's the only one, or one of the few, that speaks Spanish at the testing site. So she can connect with them, tell them what's going on, how is the process going to work, and when they're going to get their results.
Y ese seguimiento sigue porque muchas veces también estoy de voluntaria haciendo las llamadas para dar los resultados. Y muchas veces llamo, no recuerdo el nombre, pero ellos sí me recuerdan a mí. Y me dicen, no, sí, usted me tomó la prueba.
And many times, and that doesn't stop there. The process continues as she also volunteers in calling people to get them the result, the Spanish-speaking participants. So many times she doesn't even remember the name, but the people will remember her voice and say, oh, you were there the day that I got tested. So all that trust that is built from asking people to get tested, being there at the testing site, giving them the result, has allowed her to build that trust in the community.
Yo creo que ese seguimiento y esa conexión les ha ayudado mucho a las personas de la comunidad, a las personas de habla hispana, hablando español, porque puedo hacer sin mucha dificultad el seguimiento. Me dicen dónde trabajan, me dicen con quién viven, me dan los nombres, las fechas de nacimiento, y entonces podemos mandar a estas personas a seguimiento, a hacerse prueba.
So as she build that trust with them in being there, present, doing the testing, giving that also has helped her gain the information that she needs in order to know who they've been together with, or the possibility of exposure of the virus with other friends, with other co-workers, with other, family members. So it's been easier to get the information because there's that trust already built.
Great. Mariam, I wanted to ask you, as Director of Community Health Promotion for Robert Wood Johnson Barnabas Health, what do you see as the structural and systemic changes in public health that are needed to reduce barriers to testing and contact tracing in underserved communities? I particularly wanted to ask you what needs to be done to get more people like Rosabelle of the community involved in contact tracing.
So I must say that this process that we use here, and before even getting to the testing, we had to make sure that there was access to the test. The county had put together 2 testing sites, but they were not a walking distance to the members of the city, that many of them are walkers, right? So we worked with the county and the city to make sure that there was a testing site here in the city of New Brunswick for those that, don't have cars or access to license, that they could get to the testing site. And once we did that, we then helped the county recruit people like Isabel, and also myself and other members of our staff to support the testing site in the city. And as they were testing inside, we were outside giving out PPEs and giving hand sanitizers and doing all those things and making sure to tell people, you're going to get a call. It might be from a number that you don't recognize, but you need to answer that call. It's important that you answer the call. If you have any question, call our office. We were sending out the information through our through our social media all the time to make sure, if you're going to get tested on Thursday, you need to call by Monday. If you're going to be tested on Tuesday, you need to call by Friday. So that has been a constant communication with the community. And they're testing over 200 people every Thursday here in the city, and then doing the tracing. But I think building that trust like you were mentioning, to get people like Rosabel is very important. And you're going to do that by communicating information on a timely basis. Throughout the pandemic, we saw that communication and building partnership was the key to make sure that we could protect our residents, right, in vulnerable communities like the city of New Brunswick. We need to go back to those traditional ways that they communicate, and this virus was different because every agency was closed, right? Every organization was closed that we traditional partner with. Everything was through virtual calls like this one, right? So who was out there? My office was still open. We were here, from distributing food and PPEs and all of that, but we are also giving out information. We had to, at the beginning, everything was in English. We needed to translate a lot of the documents, but also make that information useful to our community, right? When I heard that we were telling people at the hospital, go home and quarantine, we knew that was going to be an issue. We live in overcrowded situation. There's not enough places for people to quarantine. So we needed to adapt that message. Do the best that you can, right? If you go to the laundromat, don't fold your clothes inside the laundromat, take it home. We had to adapt a lot of the information that we saw. If you go to the bodega, we had to work with our small businesses to make sure that we gave them free PPE so they can give it to the people, masks and all that. So the same process we had to use for the contact tracing to make sure that we created our own sheet because we couldn't find one. We developed it in English and Spanish. There were a number of scams happening also in the city that we needed to combat, and we needed to send information out. When they call you, they're not going to ask you for your bank account. They're not going to ask you for personal information. This is strictly about COVID-19. We need to understand what the plan is from the county, from the city, and in case of an emergency. One of the things that we did this summer, we implemented a youth emergency responder course for our high school students here. We saw so many families under stress because of the uncertainty. And if we have at least one or two members of the family that understands what to do in case of an emergency, what is the role of the hospital, what is the role of the police, the firemen, we will have additional people in the community that we can work with to send this information out. And it was very successful doing this with the youth in our community. So we had 2 hotspots in the city that we were able to identify the 2 hospitals and work to send information, resources to those 2 places in the city. Data became very important.
Great. Well, thank you. One thing you said really struck me, which is, sort of like the difficulty of making these contacts for contact tracing. It's sort of like in normal times, and how, having to do everything over the phone or virtually makes things all that much harder. So I want to actually go back, because also Perry mentioned, doing contact tracing for HIV. And I'm wondering if, the contrast between HIV and COVID-19 might bring out what are some of the differences and the challenges with COVID-19?
A great question. It's like I just finished writing an article about this very idea. So look, on the one hand, any disease in our country has stigma associated with it, right? So that's a challenge. HIV probably a lot more stigma than COVID-19. The difference and I think the challenge with COVID-19 is, it spreads so easily. HIV is not spread so easily, right? So here's the numbers. In the United States, since 1981, 675,000 people have died of AIDS complications. In the United States, in 8 months, 226,000 people have died of COVID-19. So the urgency is much greater here. The contact tracing issues are equally complex. HIV has the stigma piece attached to it, which makes it complicated. COVID-19 has that urgency and the speed piece associated with it because it has to happen really, really fast. And as Rupal said, it's got to happen in record time, and that's what makes it really different.
Anyone else comments about that? David, your experience at the health department, I think you mentioned sometimes it takes 5 to 7 days to get contact information. As Perry was saying, time is of the essence, and how can we do that better, I guess,
Rob, that's a very interesting question. I think what happens is because we're seeing national delays in laboratory reporting, there has to be some additional effort or additional capacity given to laboratories to report the data quickly. And I think that is key for us getting our hands on the cases and starting the contact tracing as quickly as possible. I mean, just the other day, we had somebody who had 5 days left of their self-quarantine, and they were finally getting their test results. So it does no good to put all these components in place and have delayed testing or having contacts not being cooperative because they don't see the seriousness of the disease.
Mm-hmm. You're looking at the state's dashboard this morning. It was a little over 50% of cases get contacted within 24 hours, which that seems certainly better than 5 to 6 days, but some more than 50% within 24 hours. And then also the contact within 48 hours, only a little over 50%. And I guess that's the statewide data.
Well, but to David's point, let me interject here. The state is reporting 24 hours of a test result, right? The test result might be 8 days late.
Yes.
So the first time I took the PCR test, which was like sometime this summer when I went to City MD in Newark, it took 14 days to get my result. When I did the saliva test at Rutgers, it took 1 day. So yeah, so it's a little deceiving, that data, but at least it's something.
So is there data on the test delay, the time of testing to blood draw to when the results are available in the system? Do we have that data?
I don't. We have it somewhere. It's not on the dashboard, that's for sure, because that's the biggest challenge, right? So the contact, I really think, and I don't know what David and Rupal and Miriam think about this. I think, once you get into day 5 after somebody's been infected, I don't really know what, really? Are we going to do contact tracing? I mean, I guess we should, but with every day, the benefit of contact tracing goes down.
Right. Yeah, so given that, time is so important, and at the same time you're trying to build trust with people you contact, the question for Rupal is what type of strategies, how do you, develop trust with someone who you've never spoken to before when they answer the phone and you're going to tell them this, important health information and try to elicit from them their information?
Yeah, we really try to just connect. I personally try to just connect with them and try to get into their shoes. And I try to just emphasize how important this really is. And, it just all goes down to us looking out for each other and us just trying to mitigate the spread. And we can see that in the numbers. So I really try to emphasize that when I talk to people and say that, look, this is all for, the greater good. And we just really want to mitigate, we want to save your family, your friends. We want to make sure everyone is safe. So that's kind of how I do it. I try to connect with them and try to get them to understand just the deeper meaning of all of this and try to gain their trust in that way. And also listening to them is really important, listening to why they're feeling that way, because a lot of people might be hesitant to share information because they have dealt with these kinds of situations where they can't trust us or health officials, and that's completely valid. So just kind of hearing them out and trying to, on a personal level with them and say, we're doing this for you, and really just emphasizing that we're doing this for you, your family, your friends.
Mm-hmm. Any other comments, maybe from Mariam or Rosabel, on sort of how to overcome barriers? Yeah.
one of the barriers that we were discussing before, and the need for trust also in this time because of the political environment in this country. And, a year ago, ICE was patrolling our city. Anything that has to do with information sharing is very difficult. But as we use familiar faces, as we use trusted messengers in our vulnerable communities, we can better obtain this information and help people feel safe, right? One of the things that Isabel was sharing was, people need to go back to work. And if you start asking them where they work at and that they could be, spreading the disease, they can lose their job. And they need this job to pay rent, to put food on the table. They really don't have a lot of PTOs like we have and sick days and all that. They work in factories or service industry. So that makes it very hard for them to share that information.
Mm-hmm. It's because our theme here has been, with the series of sessions that we've had in this environmental health summit, has been about environment and occupational factors and COVID-19 and health disparities. I mean, maybe someone comment more on that about how, lack of employers' protections for workers in terms of their pay, and also potentially privacy and so forth, how that enters into when you do contact tracing.
Well, earlier on, we realized that a lot of people, were called back to work, right? And we were asking them, so what's happening in the factory? Well, it's, less people per turn, per session. There's, they don't allow us to eat in the cafeteria anymore, but we're all riding there in the same bus. Many didn't have, way of protecting themselves, no mask, no hand sanitizer, and they needed the work. They were told, if you don't come, you're not going to have a job here anymore. I think that there's a number of initiatives now through the county, some programs that are going to be educating, small businesses and how to protect your employees. Some curriculum that has been now developed in Spanish to do that with the small businesses around the city that have potential to, really safeguard our workers. In terms of tracing, we've seen that, it's a big issue to tell, whomever's doing the contact tracing where you're working at, and you then end up without a job. Mm-hmm. No protection.
Yeah. Dave, thank you very much, Mariam. Dave, your experience do you interact with employers?
Yes.
Yeah.
Yes, Robert. Yeah, we do interact with employers from time to time. I mean, it can be anywhere from school boards or businesses, and most of them have been quite cooperative, helping us because it's more of a partnership to help us do the contact tracing. We let that be known as quickly and as privately as possible. So, but we, as Miriam was saying, those are issues in regards to, whether people will have a job. And at the moment, we really can't get into that. But also to a point Miriam was saying, trusted community members is actually key, even for business and organizations. I mean, religious communities, we need trusted members of the community to help reduce the barriers to getting contact tracing done.
Mm-hmm. Thanks. I guess I wanted to switch gears a little bit, maybe, unless other comments about that, employer relationships. I want to switch gears a little bit and talk a little bit about, so there's this COVID alert on New Jersey app that's now available. I just downloaded it myself over the weekend. Have you any experience with that and how that might help and what its role is in contact tracing?
Well, I think that I downloaded it too. Look, I think I'm going to be frank here because I think we find ourselves in a very difficult situation because at the beginning of the pandemic, we were very clear in the state that we were not using technology. that we were going to use yeast standard contact tracing. Now, all of a sudden, we're using technology. And, you know, I cannot tell you the amount of time that I spent on the phone with our state legislators, convincing them that we were not going to be putting probes on people and following them, right? Because that was really, really important. So I don't know. Like, I feel like the last 9 months of my life feel like when I was doing my age work in the beginning in the 80s, like, I don't know, right? Like every day is something new. And so I would encourage people, but I think there's a huge, huge level of mistrust that exists around technology. There's huge medical mistrust. And I don't know if this is going to be particularly helpful. And I'm eager to hear my colleagues who are in the trenches, like what they think about this application also.
Yes, so Rupal, Dave?
Yeah, definitely.
Mariam? Yeah.
So I don't have direct experience in terms of like asking people, because they did just launch this a couple weeks ago. I haven't done any direct contact tracing in a couple of weeks. So, but I have heard from a lot of people that a lot of the contact tracers that we do have, that there is hesitation in terms of downloading the app, because, I mean, which is completely valid. They think that, you know, they're being followed and, you know, their information is being taken, their data is taken. And yeah, so what they have told us is that all of those things are not done, but it's kind of difficult to influence people, to encourage people that these things are not being done. And with everything happening and just how our society is with technology, they're just not trusting the app. There are a good portion of people that do trust it and do download it, but I'm not really sure how it's going to go.
Can I add something onto what Rupal just said, which is here's what we do wrong in public health, and here's what we do wrong in clinical care. And I actually just finished writing something about this too. We assume that human beings are rational operators, that they make decisions based on logic and reason. But we know that's not true. We know that human beings, this is why the disease continues to spread, because people want to have a good time, right? So we have to be very, very smart about making sure that we attend to, and I think Mariam probably does this, and David does, and Rupal does this, like to people's like emotional lives, their feelings, their fears, their anxieties, because people are more than just a vector for a virus, right? They're living, breathing human beings. And so somehow the state needs to make people feel safe around this thing. Because I will tell you, we all know we're being followed. Like, you know, every time we go on the cell phone, like Trump's listening to us. Oh, I didn't say that a lot. You know that somebody's listening to us. But, and we can like live with it. But a lot of people can't live with that level of anxiety or fear in their lives.
Mm-hmm. Other comments? I think maybe Rosabelle had a comment, or Mariam?
Yes, we were discussing that, for communities of color that, have been prosecuted or, followed by ICE, it's going to be very difficult for them to know that someone is following them, that they're going to track them down, right? So those situations in their life situation at this moment might not be the best thing for them to choose to do that. And it doesn't mean that they don't understand it or that they want to do it. It's just that their life situation hasn't allowed them to use the technology in that way, when you know that somebody's going to be tracking you, that you actually did it to yourself, right?
Mm-hmm. I just wanted to remind people to ask any questions in the chat box. I think we'll get to that in a few minutes. We have a couple. I guess one last thing, maybe that's something else. Dave, it looks like you wanted to say something.
I was just going to say, our priority is basically the contact tracing and the investigation, but we do encourage people to sign up for the app. But that's been the limit of our experience with it.
Mm-hmm. My understanding is that, like, also if there's the contact would still be contacted, but the case would still be contacted by the contact tracer or person to get the contact information. That's correct, right?
Yes.
Yeah. All right. So I want to make sure we have time to get to a few questions that are in the chat. But one last question, I guess, for everybody. Unfortunately, we'll have more time to talk here. I think it's very lively and important discussion. But maybe in the final 30 seconds, minute, just if we could go around and I could ask you what you think are the top priorities, or one of the top priorities for a change that would make your work in contact tracing more effective. So we'll go in reverse order of how we started, starting with you, Mariam. Mariam, I'm sorry.
I got it. I think to continue to build that trust in vulnerable communities through communication and strengthen partnership with, public health, communities, our community-based organization is going to be key for contact tracing.
All right, thank you. Dr. Pastrana?
¿Qué consideras que van a ser la mejor manera para hacer este tipo de trabajo en el futuro?
Involucrando a más personas, bueno, para nuestro grupo, involucrando a más personas de la comunidad.
We need to connect with community people.
Interactuando más y teniendo más confianza.
And building that trust from a community-based perspective.
Great, thank you. And then Rupal?
Yeah, so I definitely agree. Community and trust are really, really important. But speaking on a more internal perspective, definitely having teamwork and communication is so key, because there are so many things that are happening, and having a diverse and open team is really important. And I know we do that a lot here at the county. So it's been really great the way that we communicate with each other and get things done in as swift way as possible.
Great, thanks. Dave?
Yes, actually, everything that the panelists have said so far, but I think another important part is investing or putting money and resources in local and state health department infrastructure, because this pandemic just shows some of the weaknesses that there currently are from the finance standpoint. And what happens is, for long-term sustainability and protecting the community, with everything people have mentioned, we need more money in public health.
We echo that.
Great. All right, and Perry, any, I guess, final words before we go to the questions about what you think we should do to make things good?
Altruism. This is the message that I've been trying to give, that wearing a mask and doing contact tracing is not about yourself. It is about the people in your life who are most vulnerable. The literature shows us that altruistic beliefs help contain diseases. So we need humanity to act in an altruistic way and care for each other. That's the message that I would say.
Great. So we have community, trust, communication, resources, and altruism. All right, so Carrie, do you want to let us know some questions that we can discuss with the panel?
Sure, actually, you're going to have to look at your host. The host gets all the panelists' questions, but I will tell you that I did get one from Jonathan Phillips, where he's basically saying that it's not a question, it's a comment. The conference series has been exceptional. Wait a minute. The conference series has been exceptional. We need to share these seminars with the entire New Jersey community. Is it recorded? And I can say the answer is yes. The answer is yes. We recorded the 6 sessions. This is our final session, but we're going to do a splash to get it out so that we don't stop with just the folks that watched it. So Rob, take a look at your host section, and you start with the other chat question.
Sure. Taking a look here. So I got bravo on heroic work. Please comment on action resulting from contact tracing, such as providing N95s, arranging hotel rooms for contacts who are crowded, etc. Something we didn't cover, which is the really important support services. So comments on that. Maybe from, I guess, Dave, who's sort of maybe more involved with coordinating, and Rupal as well at the local health department level, and then maybe Mariam as well.
Yes, basically what happens is we're starting to just get into those social additional components or wraparound services. Basically, they're done at the county level, but we have homeless populations who need support and services. So we will be working with state and local and county officials to try and meet those needs when they're identified to us. And actually, the state just has a new grant out. They're looking for vulnerable populations. So we'll be doing assessments of our communities to see where the needs are actually. And I'm sure that it's going to follow, where low income poverty situations, are going to be important factors that we have to, as the dean has mentioned, take care of other people as well.
Mm-hmm. I guess, Rupal, any comments on that in your experience of, I know you work with social workers and others at Camden County, and how does that work?
Yeah, so I have given some social support services to some people. It is a lot of referrals to our different programs that we have. And for example, if people need food support, we do food distributions every Friday, and we have been doing it all summer, and I believe we're still going to be continuing it into November as well. So we have food distribution sites. It's no questions asked. People can come up and just get a bag or box of food. And we also have other services. We do have a fairly large homeless population as well, so we try to address them as well. I don't know the details of it, but we do have homeless shelters, and they do provide hotels and things of that sort if there is anyone that comes out positive.
Mm-hmm. So it sounds like it may be somewhat like fragmented across the state in terms of what people can do and what they are doing.
I echo that. I think that, early on, hospitals needed to identify places to send people to quarantine. The prices of the motels and the hotels around here triple, claiming that, they needed to clean in a special way the room. We needed to get local foundations to help us with the cost of doing that. I think that communication is key, and making sure that what the state is providing, what local resources can provide, that there's a communication. I mean, we saw hundreds of thousands of Rutgers dorms empty, and we needed places to quarantine people. I think that, better communication on what's going to happen in emergencies like this, that we can access services on a timely basis and not wait till it's a bigger crisis.
That's a great comment. I don't know, Rosabella, any comment on that?
¿Cómo podemos proteger la gente?
Yo creo que es muy importante prepararnos ahora.
It's important that we prepare ourselves now.
Aprender de los que nos pasó en marzo.
To learn what happened in the past through this year in 2020.
Vienen tiempos difíciles y tenemos que estar preparados para evitar, porque teníamos ese problema de que una persona en la casa no se podía aislar y esa persona contagiaba a toda la familia y después tenía que ir a trabajar. Entonces es importante poner énfasis en eso, cómo lo vamos a solucionar y estar preparados.
We need to look for solutions now of how can we effectively quarantine people. We have to learn from our past experience.
Great. Yeah, I think that could be a whole other session, lessons learned from what we've experienced so far. So maybe the final question here, there's another question in the chat, which is from Mike Oshfeld, that he worked in as a clinician in an STD clinic in the late 1960s. We had a contact tracer full-time who reported unwillingness to respond was relatively rare. Has it become the mode to hang up in our more suspicious times? Do contacts worry what's in it for them to participate? Something we touched on a little bit already, but I guess, and Dr. Perry mentioned about sort of the contrast to that being out there. But I guess what can we do to try to overcome that?
Well, I mean, part of it is like, in our control in our hands right now, which is like, unless you have like leadership, like we have in the state of New Jersey and New York, where people who believe in public health and believe that disease actually passes from person to person, and it's not a conspiracy theory that aliens are coming from heaven and like, giving us this disease, it's not going to change. And so what I think the problem, and I appreciate the comment of the participant, because I think it was a very different time. There was this there's this polarization now that is political, that is just going to make, no matter what we say, a group of people be resistant to us. It is like, I have spent the last few weekends of my life doing calls, whatever reason, and I cannot tell you the number of people when I call them and talk to them about voting who just scream at me with disgusting slurs and hang up. But that's the society we live in right now. So if we change society, that's my answer. Wave a magic wand.
One comment that Rosabel just made is that we need to strengthen that relationship between public health and community, so we can expand that trust in the system. Also, we need to reinforce the services and the funding that public health gets. We have a skeleton of a public health compared to when I started working here back in the 80s to now. We have lost so much resources, and it's going to be very hard to do this kind of work if we don't strengthen our public health structure and we don't make those connections with the community.
Well, with that, any final word? I think obviously we've identified some of the very specific problems and also the big picture problems in terms of challenges, in terms of improving contact tracing. And I really want to thank you all for being on the panel and for participating, and the audience as well for their participation. I wanted to thank Carrie Butch for supporting the whole series throughout and coordinating the series throughout. And then also Maria for her technical support, Maria Crescenzio, throughout the program in the last 6 weeks. So thank you all. I think it's 11 o'clock, and it was a pleasure meeting with you, and go forward and let's kill this virus. Thanks. Okay, take care.